My name is Ayon and my topic is congestive heart failure. Definition. Congestive heart failure is a condition in which the heart function as a pump is inadequate to deliver oxygen required to the body.
A healthy heart, as seen here, beats approximately 60 to 100 times a minute, providing oxygen-rich blood to the rest of the body. The lower left chamber of the heart, called the left ventricle, is the main pumping chamber. There are many different conditions that can lead to congestive heart failure, including a prior heart attack, high blood pressure, and coronary artery disease. Any of these can prevent the heart from efficiently pumping blood to the rest of the body. As a result, the heart may beat faster, and the ventricle may increase in size, becoming an even less effective pump. When the kidneys sense the reduced blood flow, they attempt to compensate by retaining more water and salt. This excess fluid retention often causes congestion in the tissues and results in swelling and an increased strain on an already weak.
Signs and symptoms. Exterior dyspnea and dyspnea at rest. Ophthalmia, acute pulmonary edema, chest pain, tachycardia, fatigue and weakness, nocturia and oliguria, anorexia, weight loss, and nausea.
Heart failure is typically a chronic or ongoing condition that develops slowly over time. Some patients with heart failure may not have noticeable symptoms. Others may have multiple symptoms, ranging from mild to severe, and these may come or go over time. Some people with heart failure experience fatigue and difficulty completing daily activities. So, activities that once seemed easy, like walking the dog, climbing up the stairs, or even carrying a bag of groceries, may make you feel tired or short of breath. If you notice that you're having trouble completing daily tasks like these, you should speak to your doctor. Other people notice swelling, also called edema, in the legs, feet, and abdomen. This congestion occurs because blood flow out of the heart slows, and therefore blood returning to the heart backs up.
Diagnosis. Major criteria include the following: paroxysmal nocturnal dyspnea, weight loss of 4.5 pounds in 5 days in repose to treatment, neck vein distension, rest, acute pulmonary edema, hepatojugular reflux, S3, gallop, central venous pressure greater than 16
There is no
centimeters.
single test to diagnose heart failure. Your doctor will ask you about your medical history, perform a physical exam, and see whether you have any risk factors for heart failure, such as high blood pressure. In addition, the doctor may order the following: blood tests to determine how your heart and other organs are functioning, including the hormone BNP, which is made by the heart and shows how well it's working. A stress test. You'll walk on a treadmill or pedal on a stationary bike while your doctor assesses how well your heart responds to activity. A chest x-ray will show the size of your heart and whether there is fluid in your lungs. In heart failure, the heart may be larger than normal. An x-ray can also rule out other conditions that may be causing your symptoms. An electrocardiogram, or ECG, can uncover problems with your heart's rhythm and help your doctor determine whether your heart failure is due to heart rhythm problems or
Acute descompensation. In acute descompensated heart failure, the immediate goal is to reestablish adequate perfusion and oxygen delivery to end organs. This entails ensuring that airway, breathing, and circulation are adequate. Immediately, treatment usually involves some combination of vasodilators such as nitroglycerin, diuretics such as furosemide, and possibly non-invasive positive pressure ventilation.
Failure is a state characterized by volume and pressure overload, hemodynamic abnormalities, and activation of neurohormonal systems, including the renin-angiotensin-aldosterone and sympathetic nervous systems, and the counter-regulatory natriuretic peptide system. The renin-angiotensin-aldosterone and sympathetic nervous systems increase vasoconstriction and sodium and fluid retention, which can lead to worsening heart failure, while the natriuretic peptides serve as beneficial counter-regulatory hormones. endogenous human B-type natriuretic peptide, or HBNP, is secreted by the ventricular myocardium in response to pressure overload and wall stretch.
The cause: coronary artery disease, high blood pressure, long-standing alcohol abuse, disorders of the heart valve, unknown cause, such as after recovery from myocarditis.
Artery disease, also called hardening of the arteries. This is due to fatty deposits or plaque buildup in the walls of the arteries that supply the heart with blood. Over time, coronary artery disease can weaken heart muscle. If a blockage in the artery actually leads to a heart attack, the heart muscle is not only starved of oxygen, but actually dies, leading to heart failure. Other common causes of heart failure include hypertension or high blood pressure, which puts pressure on the heart to pump and work harder. Cardiomyopathy. This is a general term for abnormal changes in the heart muscle caused by a range of conditions such as infections or drug or alcohol abuse. Valvular heart disease, whereby one or more of the valves in the heart don't work properly. Congenital heart defect.
The treatment. The most important and yet most neglected aspect of treatment involves lifestyle modification.
Great medical tools for treatment of heart failure, including very powerful drugs that we can use for the treatment of heart failure. And despite that, there is still a substantial proportion of patients with heart failure who will progress. Heart failure will worsen, and they need hospitalization, they remain symptomatic, and they ultimately die of the disease. And so there are various very interesting and exciting non-pharmacologic therapies that are available for the treatment of heart failure. Included in that would be cardiac resynchronization therapy. Now, cardiac pacemakers have been around for a long time, and those are generally devices, small devices that are implanted just under the skin, under the collarbone, attached to a pacer lead that travels through a vein into the heart. And those pacemaker devices provide electrical stimuli to pace the heart at a certain rate. In heart failure, a substantial proportion of patients have what we call dysynchrony.
Etiology. Most patients who present with significant heart failure do so because of inability to provide adequate cardiac output in that setting. This is often a combination of the cause listed below in the setting of an abnormal myocardium.
Risk factors for heart failure can be present without your knowledge and slowly cause wear and tear of the heart, leading to heart failure. Coronary artery disease occurs when cholesterol and fatty deposit build up in the heart's arteries and less blood reaches the heart muscle and causes a heart attack. The remaining healthy heart tissue must pump harder. Hypertension or high blood pressure increases the risk of heart failure by 2 to 3 times. With high blood pressure, the heart has to pump harder to keep the blood circulating. Abnormal heart valves due to disease or infection. Abnormal heart rhythms cause the heart to beat too fast, slow, or irregularly. Severe anemia means that there are fewer red blood cells to carry oxygen.
Prognosis. Prognosis in heart failure can be assessed in multiple ways, including clinical prediction rules and cardiopulmonary exercise testing. Clinical prediction rules use a composite of clinical factors such as lab tests and blood pressure to estimate prognosis.
Endogenous human BNP binds to the particulate guanylate cyclase receptor of vascular smooth muscle, endothelial cells, adrenal glands, and renal, tubular, and glomerular cells, leading to increased intracellular cyclic GMP levels in target tissues. Increased cyclic GMP mediates vasodilation and other effects that help to compensate for heart failure. These effects include direct venous and arterial dilation, coronary vasodilation, reduction in filling pressures and systemic vascular resistance, increased cardiac index, improved myocardial relaxation or lusitropy, reduction in fluid volume through increased sodium and water excretion, and suppression of renin-angiotensin-aldosterone system and sympathetic nervous system activity.
Epidemiology. More than 20 million people have heart failure. Worldwide, the prevalence and incidence of heart failure are increasing mostly because of increasing lifespan, but also because of increased prevalence of risk factor, and improves survival from other types of cardiovascular disease, myocardial infarction, valvular disease, and arrhythmia.
Endogenous human DMT is cleared by receptor-mediated clearance, by proteolysis by circulating endopeptidase, and partly by renal filtration.
Application in medicine. Chronic management. The goal is to prevent the development of acute decompensated in heart failure, to counteract the deleterious effects of cardiac remodeling and minimize the symptoms.
Heart failure, or CHF, affects some 4.6 million Americans, and it is the leading cause of hospitalization in people older than 65. Heart failure means that the heart is not pumping with enough force to adequately move blood, along with oxygen and nutrients, throughout the body. As a result, the kidneys respond by causing the body to retain fluid and become congested. CHF is caused by many things that damage the heart muscle, such as coronary artery disease, heart defects, diabetes, high blood pressure, obesity, and an irregular heartbeat, to name a few. The board-certified heart specialists at New York Methodist Hospital use the latest technology and procedures to diagnose and treat CHF.
Thank you.